unhealthy men drop testosterone about 1% every year. Healthy men don't start that until above age 40. Unhealthy start it in their 20s and 30s. Welcome to the Wellness Method Podcast. Hi, everybody. I'm Dr. Brad Kobsar, and today's episode is on sex and testosterone, talking about real men and real health and men of steel. All right. So today with me, I've got Marcus Jackson.
Hello.
Marcus is a good friend of mine, above all else, but he's also a professional photographer, and he is one of our Wellness Method coaches here at our clinic. And 2 years ago, he came to me. And he had some health issues he was struggling with, and
we were in bad shape, Doc.
You had some issues. You had some challenges, but you took the bull by the horns, man, and you took it on. And you made my job easy. I just basically gave you some guidance, but you took it and you ran with it, and you conquered it.
Yep.
You conquered it, and not only did you reach all your goals, but you decided. When you got there, I'm going for more, man. I'm setting the bar higher.
Set it higher, man.
And that's great because in doing what you did, you've inspired so many people, and you know that how many people have come into our program as a result of seeing what you did. It's phenomenal because it was very dramatic. The changes that you made. I mean, you probably had a few people who didn't like. Did you have some people who didn't recognize you when they saw you at first? I'm sure.
I had a bunch. They said, Marcus?
Yeah.
I said, it's me, 90 pounds lighter.
Yeah.
Yeah. I didn't believe it.
Yeah. Yeah. And I had people coming in and sitting to talk to me, and they're basically here. They're just like, I saw Marcus and I walked by him in the parking lot and didn't recognize him. And you said hello. And then, they asked you what happened and what you did. And so.
And I showed them my picture too. I showed them the progress photo.
Right. Okay.
And jaws just tried to go.
Yeah.
They can't believe it.
Yeah.
So,
yeah. So, and they came in and then they kind of followed in your footsteps, and you're still continuing. You had somebody here, I think yesterday, call in and want to join up.
Wow.
It was a high schooler.
Yeah. Actually, I met him in middle school.
Oh, is that right?
Yeah.
Okay.
Yeah. Even longer. Mm-hmm.
So yeah, you've been a very, very impactful on a lot of people and changing their lives and seeing their health transform. So thank you for that.
My pleasure. Happy I could be a part.
Well, it's great to be here talking with you. And so we're talking today as I introduced about men's health. And one of the things with men's health that we see everywhere is how society wants to paint our picture, wants us to live. And that's that buffed and toughed look, right? MMA is the fastest growing sport in America. We want to be tough. We don't want to appear vulnerable. And the interesting thing about that is when you ask females what is most attractive about a male is number one, vulnerable, number two, kind, funny, and being supportive. So it's sort of like, the male image is more like in competition with other males as opposed to the opposite sex and attracting them. Because taking care of health is what is really that's strength.
Yeah.
Right. Having the strength to make the good decisions and the proper choices so that it moves our health into a good direction, which then translates to our kids, our wife, our whole family benefits from that. And I can't tell you how many men have been dragged in here by their wife because they didn't really care about their health. They weren't really thinking about that, but they were thinking about their car.
I bet they were.
Their car is very fine tuned.
Yeah. Car's working just fine. Huh?
Yeah. I think there's a stat somewhere I have where something like 75-80% of men make sure their car is well maintained, but like 30% haven't done anything to do anything for their health in the last year, 2 years.
I used to be that guy.
You did?
I sure did. Sure did. Yeah. My first car in high school was a truck. And my mother used to joke and say that.
Brand new? Wait, you got a brand new car in high school?
Yeah. It only had 12 miles on it.
Really?
Yeah.
Oh, that's
brand
awesome.
New. What that's the different story, but I earned it. I definitely earned it. But I definitely took better care. My mom used to joke and say that truck got more baths than I did.
Right.
So, so I definitely can attest to that stat.
Yeah. I can agree with that. I actually, I had my first car in high school. Mine wasn't new. As I recall, it was pushed into our driveway, and it became my project for the next year and a half. I think my dad might have got it for me to just keep me out of trouble, keep me working on the car, and I actually ended up, it was a 1967 Mustang, and paint was all peeling. Right. Couldn't start it. I remember we ended up getting it going. Ended up buying another car so that it just to have it for parts, and stripped it down. And so, yeah, spent a lot of hours out there.
Wow.
And I actually have a picture. I have a picture of that car from where it was when I started, and to where it was after I made all the changes of it. And at that time, it was like, wow, that's that same car. But the really interesting thing is I look at it now and I look in the transformation of myself.
Wow.
And that's actually pretty interesting because, in high school, I was this long haired kind of playing the rock band guy. And then by the time the car was where I wanted it to be, I had totally transformed myself too for this complete. I'll have to show you the pictures.
Yeah, I want to see it. I'd love to see that.
It's a pretty dramatic
wow.
shift.
Interesting.
So with men's health, though, getting back to that, I'm going to just give you some statistics here.
Okay.
First of all, there's something called andropause. Okay. We all know what menopause is. Everybody's heard of that. But andropause is a real thing. And it's basically the male version of menopause. But the difference with it, the reason why it doesn't get as much conversation is because it's so much more gradual. So the drop in estrogen in females is pretty dramatic. It happens like in a 10-year period, really sharp decline. But for males, maybe 20, between 40 and 60 years old. For males, it starts around 20. And it continues to decline up into our 80s. So it's much more gradual. So it's kind of like the frog in boiling water.
Yeah.
Where, they just stay in there until they get boiled. If you turn up the heat slow enough. And that's essentially what's happening with that. But life expectancy. Yeah. So unhealthy men drop testosterone about 1% every year. Healthy men don't start that until above age 40. Unhealthy start it in their 20s and 30s. So a healthy 20-year-old, actually an average 20-year-old today has the same testosterone levels of a 60-year-old from the 1980s.
Whoa.
So and that's just a reflection on our overall health. Really.
Wow.
So that's it's not just specific testosterone, but that's a pretty dramatic shift.
That is pretty staggering. Yeah.
Life expectancy for men is lower than women, right? About 5 years, 80 years old for females, 75 years old for males. Men smoke more, they drink more, they don't seek medical help. And they also define themselves by our jobs. That's what we do.
Yeah.
And that's what we talk about a lot with each other. So any thoughts on that? What do you?
I mean, I can attest to and understand all those things. When I was younger, I didn't take great care of myself, especially, if I was running and I got sprained an ankle, got hurt, or I didn't feel right inside, I'd kind of walked it off or waited a week and it went away instead of kind of going to the doctor and get checked. And so that's, even, in my past family, like we weren't people that regularly would go to the doctor, and so it makes total sense. It makes total sense of not, taking care of your body and things like that. And even, just getting normal checkups. So at least you kind of know kind of where you stand and things like that. So yeah, and those stats are, losing the testosterone like that for guys so gradual versus the ladies. That's just a really staggering stat, but it makes sense. You see, older guys having kids all the time and, they still have that, that piece of kind of their, their reproductive stuff kind of going on because they still have testosterone there, and so, and they can produce the cells they need to have kids. So,
it's sort of like that whole machismo thing that we have.
Yeah.
Really translates into how we look at our health.
Exactly.
If we have an injury or a pain or something, don't be a baby. Don't cry about it. What are you going to be?
Walk it off,
Yeah. Spit on it or something.
Yeah. No.
Rub some dirt on it. Yeah. Some of the things that people say or that we say to each other, but yeah, but the whole testosterone thing, it gets a lot of attention, and rightly so. But it's sort of like it becomes also there's this what I like to call the testosterone panacea, where it's like, wow, if I just get my testosterone levels corrected, then everything's going to be great.
Fine.
And so that's what the media's got. That's like the images you see, but the thing is, the problem with just focusing on that one aspect of health is you're focusing on a symptom rather than the underlying cause, because there's a reason why we become deficient in testosterone. It's because it's our overall health is declined.
No, I agree.
Yeah, we have a massive amount of in our country, in America, our chronic disease rate is 60%. So what that means is if you're healthy, you're the abnormal one. You're part of the 40%. You don't have any health issues. That's weird.
Wow.
It's a sad fact, but it's true. So there's so much sickness and chronic disease that it's not looked at as abnormal. So it doesn't get our attention as much, and it's just sort of like, well, what do you got? Oh, I got this. What medications are you taking? I got that.
It's almost like it's a badge of honor because I got diabetes, or I got this, or it's like I said, it's almost like it's like some tattoo or some great. It's like it's an opportunity for you to cut your life short.
Right.
That's what I see it as.
It is. It fits into the machismo thing again. It's like, man, I had my shoulder replaced, and
or I had my hip, or I tore my Achilles, or it's like that's not great news.
Yeah. And it's like, it's common conversation.
Yeah.
It just becomes like, that's what people sometimes will talk about, at parties or
instead of like how they're restoring or recreating or getting their health back in order.
Yeah. It's like, well, what surgeon did you see? Well, my surgeon, he's the one for the 49ers. And
right. No, you're absolutely right.
Like there's almost like a bragging thing, and people keep their DVDs of their surgeries and that type of thing, and come over and want to see my I'll show you my double
talk
bypass.
About their war wounds, right?
Right.
Especially with the people who have referred to their program, I'm definitely trying to change the narrative around our conversations around what optimal health looks like. I think I mentioned to you, like, that's not something that I grew up talking a lot about, because that's not what we knew, But now that I understand, like, anyone who'll listen, or if it comes up a conversation, like I listen, and I try to gently nudge and at least inform people about things that they may not have even thought about. Because some people I talk to, they don't think optimal health is for them. They felt like I did, like I was always going to be just this way until I die, and you don't have to be like that, But they don't know, and a lot of times you only do what you know. Right. Until you know something else,
right?
So
yeah, I remember you sharing that with me for the first time, and I was really surprised, because I guess I've been blessed in that I've been around enough people that were health oriented or pursuing health. It never even occurred to me that optimal health is not for me.
Yeah.
I wasn't always pursuing it, but I definitely in my younger years was going the opposite direction. But I always, I was just, it never occurred to me that it wasn't possible for me. And so that was a really big eye opener when you shared that with me, because if you're feeling that way, there's other people that are feeling that way too. And so that's an important point. With when it comes to, talking about your journey and the way that you went through it, can you share a little bit more of the details of that?
Yeah, sure. I remember having a conversation with my wife Sharika before we got married about wanting something better health wise. I didn't want to be a couple that kind of expanded out. I wanted to retract in and be healthy. I didn't know what that was going to take, what it looked like, but I knew that we had to do something different. And so we got information about the clinic and we came in. And as I was sitting there, listening to just how unhealthy I had allowed myself to become, a little light deep down inside me, kind of got a little brighter because I had some information I didn't have before.
Right.
And
yeah,
so
it's empowering.
it really is. And so, that light was pretty dim for a long time. And, as I'm seeing, getting information from you and learning.
Do you remember, was there any one particular piece of information that stood out for you?
When you told us that if we hadn't made any changes, that we were probably looking at heart attack, stroke, diabetes, full blown autoimmune, like that definitely hit me hard. Because for us, we had just gotten married, want to be married 4 or 5 months, no children, and I knew I wanted kids.
Right.
And I knew that if I was in the hospital or dead, that wasn't going to be an option for me. And so we had a lot of the choice wasn't hard to make because I knew that I didn't want to continue on that direction because I have a lot of people who have lost their lives for diabetes and heart attack, heart stuff in the past. I didn't want to end up like that, and so I knew that I had to put a stake in the ground and say, no, this stops with me. Bad health, dying early, all the extra hospital visits stops with me.
Right.
And so
generational curses.
Right. And so we made a choice, and I'm so glad that we did. I'm so glad that we did. I don't know what we have done differently if we hadn't, or if we even be around, if we hadn't made that choice. And the good news about now is that, we've set other, like you said, we've set other health goals now.
Right.
And so now that we got one, we can get another. When we get that one, we can get another, and it just keeps going,
Yeah. There's never really ever, it's an ongoing pursuit.
Yeah.
It's like exercise, working out in the gym. You can't just do it for 6 months and go, okay, I'm strong now, I'm done. No. Let's go to the next thing. It's always, and I always tell people that, it's up to you to set the bar where you want your health. I don't do that for you. As long as my job is to make sure your health's at a risk, but then where you want to take it from the optimal health level, that's got to be up to you. It's still my job to get you where you want to go and help and guide you and assist you. I mean, I know you're going to obviously be the one doing the work to do that.
Right.
But yeah, it's what level do you want to take it to?
Right.
That's and that's fun, and it's an always evolving thing, I think. But as long as you're pursuing that and going in the right direction, there's going to be times in life when things get busy, right?
Yeah.
And your health sometimes gets out of balance a little bit. And I always tell people, don't make that time where you're trying to move the needle.
Yeah.
Just make it that time where you're just trying to maintain where you're at. Okay. Because life gets stressful and throws stuff at us all the time.
And I even think a lot of times, just as humans, we by nature overcomplicate things. And we don't have to overcomplicate things. You said just maintain it,
right.
Instead of trying to, let me do this and overcompensate it. No, just if you fell off, get back on and just stay the course,
Right. Yeah. There's a book I want to write someday. It's called The Wellness Almanac.
Oh, wow.
And so what I wanted is to set it up by seasons for people, so that there's different seasons. Not only the regular seasons, but the seasons we go through in our life.
Yeah.
We go through different seasons. And if there's any way that you can foresee them before they come, you can plan everything, your health, your lifestyle around that, so that you can set yourself up to succeed. That'd be a pretty cool thing. But
I'd like to read that one. I'll Amazon that one. Let me know when you write it.
Right.
Oh.
But it's also the other thing that you said is when you do fall off,
Mhm.
don't beat yourself up,
Mm.
right? And that's something I see, which is a sad thing as well,
Yeah.
is when people do fall off, instead of just sort of like, brushing off the dust and
Mhm.
going, okay, well, let's get back on. Or maybe I'll wait for this, 2-week period or 3-week period to pass, and then
Yeah.
I'll get back on. They just kind of, they beat themselves up.
Mm.
They emotional part of it overtakes them,
Yeah.
the depression, the whatever effects it has on their
And
self-esteem.
it's not hard. It's not, I mean, if
It's
again, like I've mentioned, if you're not if you don't understand what optimal health even looks like or is even attainable, it's easy to self-talk yourself back the opposite direction. It's not hard to do, because I've almost done it a couple of times myself. So I'm speaking from experience.
right.
But again, like it's that light, it's understanding, and realizing that you can, like, it is for you. It's for whoever is going to decide to get to the finish line,
Right. Yeah, because it's a marathon, not a sprint.
That's it. That's it. So true.
Okay, I want to talk a little bit more about testosterone, and the
Oh yeah.
testosterone panacea. So, you see all these, there's a lot of testosterone clinics that are up,
Mhm.
different advertisement billboards for testosterone. I just want to hit on this a little bit, and just let people know that FDA has not been approved. The FDA has not approved testosterone to improve strength, increase athletic performance, physical appearance, or prevent aging. Okay, so a lot of people are going for those reasons. It
Mhm.
has not been approved for that. It does do a lot of good things. It helps with your sexual response. It
Mhm.
helps with your memory, blood pressure, insulin sensitivity, lowering cholesterol, some of the effects of age-related mental decline.
Mhm.
And excess can lead to aggression. I think that people know that one, the old roid rage.
That's that's about right.
But there is a lot of side effects with testosterone therapy. So that the replacement therapy,
Mhm.
it is it's an unproven as far as the science of it
Mhm.
in doing the things that it claims to do.
Okay.
Okay, so it's not the magic pill, right? We all know that
It's not.
there's no
There
magic
is
pill
no
out
magic
there.
pill.
So here's some of the side effects. This is one study that was done in the New England Journal of Medicine in 2009. They actually had to terminate the study because of the dangerous side effects in
Oh,
that
wow.
one. Another study in 2010 was halted when early results showed men had noticeably more heart problems, heart issues, cardiovascular issues. There's also been some concern that it can stimulate the growth of prostate cancer cells, increased blood clots in your legs. So the thrombosis, that it's called, the venous thrombosis, lower sperm count, causes symptoms in the lower urinary tract, polycythemia, a type of blood cancer, and the ever popular painful swollen breasts. That's what we all want.
Wow.
So those are just some of the side effects. And the other thing that you see a lot is the bioidentical. Wow, bioidentical hormones. Well, that sounds really good. That sounds kind of natural, but it's not. They're actually just as synthetic as regular testosterone hormone replacement therapy is. And according to the FDA, it's no more effective.
Wow.
Okay, bioidentical means it's identical to the hormones that you produce, but it's not your hormone. It's not natural. It's still produced in a petri dish in a lab.
Wow. Interesting.
Yeah. So that's a lot of people reaching for that magic pill.
Yeah.
I have people coming in all the time. Sometimes they get some temporary improvement, but like any medication, it's always going to be, your body's going to adapt to it after a while. And what happens is actually you stop producing as much testosterone because your body
it's already finding it somewhere else. So why produce it?
Right. Yep. So that's going to lower your levels. So
wow.
Some quick fun facts.
Okay. We like fun facts.
Men who are exposed to ovulating women have higher levels of testosterone.
Hey, all right.
Adult male testosterone levels are 20 times greater than females.
Huh.
So men who have children have lower testosterone. And that probably relates to this next one, that sleep increases testosterone levels. If you have kids around the house, you might not sleep quite as much.
Right.
And in females, not in males, in females, falling in love increases their testosterone levels.
Oh, wow.
Interesting, huh?
That is very interesting. The body is such a fascinating thing. Yeah.
As far as ways to stimulate your testosterone naturally, so there are some things that you can do. One of them is exercise, but it needs to be a very specific type of exercise. Okay. And what it needs to be is strength training.
Right.
Okay. And it has to be heavy weight. It can't be lightweight to stimulate that hormone testosterone response. And it's not only testosterone, it's also growth hormone, which is also going to help with muscle growth. But so the big thing is the big muscles.
Right.
So the chest muscles, so the bench press, the back, big muscle groups. But the biggest one of all is going to be the legs. Okay. The squats, heavy lunges. For God forbid, just make sure that you have good form. Okay.
Right.
And a lot of people, a lot of people will ask me, is this, how safe is this? Is this a safe exercise to do? And I always tell them any exercise is potentially dangerous if you don't do it right.
Yeah.
Okay. So there's some higher risks with other types of exercise. But as long as your form is good and you're using your body the way that it's designed to be used, you're going to be good.
Should be good to go. Yeah.
Yeah. And don't ever compromise your form and your posture by trying to do more weight.
Yeah.
Yeah. So
been there before too.
Yeah. So, squats, lunges, those are probably my two go-tos. Is like, those are the most important ones. And there's a specific test that you can do with testosterone. And me and my wife call it the leg day test.
Oh, I think I see where this is going.
So yeah, if we do a heavy leg workout, we let each other know to be prepared. It's a leg workout day.
Yeah. Nothing wrong with that. At least you know. That's good. Yeah.
So there's also and one of the signs of a healthy testosterone is when he wakes up in the morning before you do. Right. As a teenager, that was a pretty common thing.
Yeah. Oh yeah.
But as we get older, if our health is in a good place, that can still continue. Right. So that was a good home test for all of you guys out there to do if you want to know.
That is a good home test.
Levels are.
Glad I passed both of those.
Yeah. So I wanted to just ask you if you have any stories that you can share with us about this particular area of health.
I know that I when I was, I guess, college age, I used to be really into Men's Health magazine.
Right.
And I read this article, and it basically said that for every 30 pounds of weight you lose, you gain an extra inch in length on your penis. And I was like, this seems really weird.
Right.
And again, I hadn't lost weight, until, a year ago. And it's accurate, Doc. It's about right. I lost 90 pounds and there's some extra there. So
yeah, that makes sense though, actually, because there's this physical obstruction.
Yeah.
That's going to be in the way.
Yeah.
So I wonder if that works on the female side too. If they lose 30 pounds, if they get an extra inch.
Well, I don't. It all depends on like what inch they're actually looking to gain. Some ladies go, I don't want to gain an inch. I don't know. Maybe I don't know.
Right.
I don't know. I've asked my wife. I don't know. That's
Because if it's a physical thing from the male side,
mhm.
it wouldn't be, it makes sense that it would be a physical thing from the female
Female side
side
too.
as well,
Yeah.
right?
Hmm. It
I
makes
don't
sense to
know.
me, but I didn't. Again, when I first
I'll
met
have to
her, I was like,
research that.
yeah,
Maybe I'll have to Google that.
I know you will. But one thing I will say is during the program, like everything about sex changed for me because when you're 300 pounds, having sex during the course with your wife, it's one way, but when you lose 20 pounds, 40 pounds, 90 pounds, like first of all, you're not fighting against your body anymore,
Right. Yeah.
Um, you know, you have
Just in
a
terms of agility and
yeah,
athletics.
yeah, like and just outside of being more enjoyable, like there's a lot less again body in the way to have to be concerned. There's a lot more closer connection, with your partner. And so, that's been really, really that's been really good for my relationship with my wife, and it's really brought us close together. Not just the sex, but I mean, just having a lot less of us to fight through when we're not just sex, but even when we're like hugging.
Right. Right.
Like my wife would joke she can actually put her arms and pray behind my back, which when I first met her,
That's awesome.
and this is around my shoulders. This is not, me under my arm. This is around, my whole body, which when I first met her, that was impossible.
Right.
And so just having that less girth to be closer, really changes a lot of things. And then, like I said, throughout the program, you just noticed, an increase, as far as, sensitivity and connection. And I think a lot of that stuff, was mental too, because there's your body's not having to work to pump blood and deal with all the extra weight. Your body can actually go and do what it needs to do a lot quicker, and so, yeah. And so so, through our 5-month program, it definitely, I mean, it wasn't bad before, but it definitely was greater. It is increased, and just, the quality that we experienced, over the time we were in the program.
Yeah. And that intimacy it's an important part of our relationship. Even though we don't, publicly talk about it or talk about it comfortably, freely, it's a critical piece, and it can cause the relationship to deteriorate. I mean, that's someone, if a man, his testosterone levels become so decreased, and then we have the problem of ED and erectile dysfunction, right? And that causes, first of all, that's a subject nobody wants to talk about, including your doctor.
Right? Yeah,
your doctor's like, well, if he has a problem, he'll bring it up, and the patient is like, well, I hope he asks me about this. But that is and so if you're experiencing that as a man, it's not something you're excited to share.
No.
And you're maybe even so embarrassed that you don't even want to talk about it. And then your wife thinks, oh, well, he's lost interest in me now. So now that's gonna have like other, it just adds more layers and more layers to the problem.
Sure does.
And and I would, just even the comfort level in your skin too, in being around each other is just going to be much more of you're able to just connect better. Have a stronger connection.
And like I said, it's a much more heightened experience, from where it used to be to where it is now. Like these things, everything is heightened,
Right.
So
yeah, at all levels, right?
Yeah. I mean, so my guess is you knew all this stuff was going to happen. You just didn't tell us, which is totally fine by me. So
yes, I did. It's something that I do want to start talking about more, and that's why we're doing this today.
Good.
Because it is important. It's an important topic, just because there's a little bit of discomfort around it, right?
Yeah, and in my mind, there shouldn't be, because we all have bodies, right? We all have sexual organs, right?
Exactly.
We all have minds, and if you can talk about your mind, you can talk about a broken bone,
right?
Why can't you talk about sex?
Right.
And testosterone, and better ways to ward off things like ED, and how to deal with those things. So yeah.
Yeah.
Mhm.
Yeah. Which is becoming just a bigger and bigger problem.
Yeah.
One thing I want to talk about in with testosterone is, like all hormones in our body, there's always a hormone that it's counterbalance.
Right.
So you hear this term all the time. You need to balance your hormones. Well, what does that mean? Well, you're talking about the hormone that is in counterbalance with it. So with insulin, everybody talks about insulin. Everybody knows that one, but very few people have ever heard of glucagon. And glucagon is the counterbalance for insulin. So one raises blood sugar, one lowers blood sugar. There's always going to be that counter effect. Testosterone has its counterbalance, which is estrogen. Estrogen is, we all know, is the female hormone, but males have estrogen too, just like females have testosterone.
Yeah.
So there's a lot of estrogen in our commercial products. Okay. There's a lot of estrogen in different hand lotions, creams, even receipts that we get from the receipts from the store.
Supermarket. Yeah.
Yeah. So always tell them, just here, put the receipt in the bag.
I don't want it.
Right. Yeah. But plastics is another big one. Plastic water bottles. If you're heating Tupperware in your microwave, estrogen is coming in through that plastic into your food. And this is one thing. There's this one study that was done on a particular aftershave balm.
Oh, wow.
Was used by a 46-year-old guy for 3 years, and it increased his estrogen by 10 times.
Wow.
So it's not just, and what happens then, it's not just the testosterone levels by themselves that are as important, but how is it balanced to that estrogen? And if one becomes more dominant than it's supposed to, it's going to have those side effects, because now your estrogen is higher by ratio. Just by default, your testosterone levels are going to be lower in comparison.
Yeah.
Okay. So estrogen dominance has become a big problem for a lot of males. Some of the signs of estrogen dominance I'll go through really just really quickly. Stroke, fatigue, heart disease, increased fat tissue, lower libido, increased erectile dysfunction, loss of muscle tone, increased size of breast tissue, and that then that leads to fun things like loss of hair, high blood pressure, high cholesterol, osteoporosis. And then the emotional problem issues as well: depression, mood swings, lack of motivation, loss of concentration, memory becomes affected, and of course, confidence and self-esteem. And then, the effects in the bedroom as well. Right. So there's not only the erectile dysfunction we talked about, but also just loss of desire, your lower semen volume, weaker orgasms. There's actually becomes a numbness in your genital area.
Oh, wow.
Yeah. And atrophy as well. So not a lot of fun stuff there. So it's important to be careful with that balance. And so there's another balance though too that I just want to touch really quickly. And that is your cortisol levels. Cortisol is the stress hormone. Right. When your body gets too much stress, your cortisol levels increase. So when that happens, there's something called the testosterone steal. And what's happening there is your body has to channel more resources into producing cortisol. So it takes the resources that were going to your testosterone because the cortisol is a bigger priority. Now, but it's not just testosterone. It happens with a lot of hormones. It happens with estrogen as well. It happens with androstenedione, which is another one of the male hormones. So, you want to make sure that your overall stress levels are also being managed, because it's not just the estrogen, it's also the cortisol that you have to worry about. So just, things like, the typical stress management stuff, just making sure that you're eating healthy, getting some exercise, um, getting some time, some quiet time, for meditation and prayer every
Mhm.
day, avoiding too many stimulants,
Having some good
coffee,
balance. Yeah.
yeah,
Mhm.
the rock star drinks and all that stuff. And then there's the 5 Ps. The
Uh-oh.
5 Ps. Having a place where
Mhm.
you can have that's your own to go and have some quiet time, that meditation time, prayer, pacing your breath. Breathing is a really
Mhm.
important and easy way that you can put yourself into a relaxation response.
Okay.
Physical touch
Mm.
really helps a lot. So that's another reason for having that 30-second hug that you talked about.
Yeah.
That will actually lower your heart rate,
Yeah.
lower your breathing rate, lower your blood pressure. So those are some of the ideas that I offer to people in our clinic.
Wow.
And there is one other thing I wanted to talk about with some practical tips.
Okay.
But I did want to talk about just couples, and we do have quite a few couples that go through our
Mhm.
program.
Mhm.
And I just wanted to ask you if you could share how you think that your experience was different going through this transformation
Mhm.
with your wife as opposed to if you had to do it alone.
Yeah, and my wife and I talked to a lot of couples about this, in particular. Excuse me, because if you're doing things by yourself, it's like they're definitely doable. But when you have a partner, even if it's just a friend, not even like a spouse, but you always have someone that you can lean on if you're having a rough day.
Right.
If you're having a challenge, and I definitely attribute most of my success to just being able to talk to my wife when she got home from work at the time. She was, working in retail. I did a lot of the cooking. And so that was kind of my part in making sure that I supported her, that she had the food that she needed. And when she got home, we had dinner. We'd have conversations about, our day and stuff. And if I was having a rough day or in a indifferent place, I could vent, I could get it out. And I had some accountability that way too. Someone who I could trust. I knew who was in my corner. Win, lose, or draw, who's gonna have my back, and vice versa. When she came home and she had a rough day, we were able to process and have some really meaningful conversation about next steps to make sure that we finished strong together.
Right.
Because that finishing the program strong together was a part of our family goals. So it wasn't just a Marcus goal or a Shrika goal. Like that was our collective goal. And we agreed that this is what we needed to do for our family. And so it's almost like a non-negotiable.
Right.
I think that once we made it a non-negotiable, it made our conversations a bit more productive because we knew that at the end of the day, we weren't going to quit.
Right.
We weren't going to stop. Like we were going to get this goal.
Nice.
So yeah.
In it to win it.
Pretty much. And we're still in it to win it.
Yeah.
We haven't quite won it yet, but we're a lot closer than we were about a year ago.
Did you guys find that you had sort of a healthy competition at times?
Only when we got to the workout part.
Okay.
Shrika likes to run.
Right.
I'm by design. I'm not really. I grew up playing baseball, and so we ran, around the bases or an outfield. But Shrika did some cross country, and so she's a runner. She likes to run, and so every now and then, she'll try to pull me along a little further. But no, like we really were just in a supportive space, and just making sure that we each had what we needed to get through that day or that week or that month or that phase of the program.
Yeah. Yeah. And that's, and I always tell people, like, even if you don't do it with your couple, with your spouse or that, as long as they're supportive.
Yeah.
Right. As long as they're not like coming home and eating Twinkies or something like at the dinner table, like as long as they're, I always just tell the spouse if they're not doing it with you, just, if you're going to do that stuff, just do it out in the garage,
right?
Or don't bring it home, just support them. And,
I mean, another really cool thing is like, Trig and I were able to get our parents in the program, and, her parents are together. They live in Wisconsin, and my mother's here in California, and she did it by herself,
Right.
I mean, again, like, I will call her and check on her. So she wasn't totally alone, but if, she had really good results, and so it's definitely doable. But when I talked to her, she said, yeah, there was some touch and go moments there, because it's just you and your thoughts sometimes, and your old habits that try to come back up.
Right.
And you have no one to, at least like in the vicinity that you can reach out to. You have to call or get online, and which takes time. And by that time, you could have talked yourself into really going backwards. So it's her story is definitely a testament that it can be done.
Right.
My mom's in her 70s, so, and she did it, and it can be done. But it's definitely, easier is not the word, but it's less of a challenge when you have someone doing it together with you.
Yeah. Yeah. I mean, we have our coaches that are there for you
Yep.
and help you out, but
Yep.
they can't be there all the time. And so it's nice when you have like somebody that's really right there with you. All right. So I just want to end with some another tip here.
Okay.
And then we'll wrap up.
Okay.
So we've talked about some exercises that you can do. We talked about the home test you can do for testosterone levels.
Again, I passed both of those. I'm happy.
Yeah, if he's like up, like wanting to go shopping for a hat, then, that's a good sign.
Right.
The right kind of, I just wanted to talk about, some people, they do everything right. Okay. We have some people who they go through the program, they followed all the rules. They did all the stuff that they needed to do. But we have this like about 5 to 7% of people who, man, they're still, everything's feeling great. They've resolved a whole bunch of conditions, but there's still like this one stubborn thing. And sometimes this is it. And so there is a natural supplement that I do recommend for people. And it's called Vitality, ironically enough. And it's a formula. It's not just one particular supplement. It's a formula. So I don't want to go through all the different ones.
Okay.
But I just want to quote a couple of studies on it. I've got 4 here in front of me. One from 2002. It was used for 3 weeks on 30 males. And in that 3-week time, it improved by 82% physical, sexual, and mental health. Another one in 2005 on 20 males. In 2 months, improved sexual desire, moods, and performance. And another one in 2011, they had 76 males on this one. And this one was published. I've got the journal here, First International Journal of Andrologia, where they found in one month, their serum testosterone levels rose 47%.
Wow.
So from 5.66 to 8.31. So that's a pretty dramatic increase. So just you guys, you don't have to struggle.
You
don't. Vitality is for men who they want to feel their best and have more energy to live life and enjoy all aspects of life.
Right.
And to do that for a long time. So thank you, my friend. I really appreciate you being here today.
My pleasure. I hope you invite me back again. This is great.
Yeah, that would be great. Will you do that?
Of course.
Okay, awesome.
Of course.
Okay, we'll find another good topic and reconvene.
Perfect.
All right. Thanks, everybody. Thanks for being here. Thank you, Marcus. And look forward to talking to you guys next time.